If the patient is receiving oxygen or is on mechanical ventilation, verify that therapy has been underway for 20 to 30 minutes before obtaining an ABG sample. Assess circulation distal to the intended site using pulse oximetry, Doppler flow study, or the modified Allen test. If the radial and brachial arteries are insufficient for puncture, assess the femoral arteries for puncture. For a radial artery puncture, assist the patient into a semi-recumbent position if possible. Position the patient's upper extremity extended flat with the palm up and a rolled towel underneath the wrist to assist with extension. Palpate the artery with the index and middle fingers of the non-dominant hand and locate the point of maximal pulsation. For brachial artery puncture, assist the patient into a semi-recumbent position if possible. Position the patient's upper extremity extended flat with the palm up and a rolled towel underneath the elbow to assist with extension. Palpate the artery with the index and middle fingers of the non-dominant hand and locate the point of maximal pulsation. For femoral artery puncture, assist the patient into a supine, straight leg position. Palpate the artery with the index and middle fingers of the non-dominant hand and locate the point of maximal pulsation. Perform hand hygiene and don gloves. Administer a local anesthetic as prescribed or per the organization's practice. Wait the appropriate amount of time for the anesthetic to take effect. The amount of time depends on the anesthetic. Perform hand hygiene and don gloves. Don additional PPE based on the patient's need for isolation precautions or the risk of exposure to bodily fluids. Cleanse the insertion site with a single-use sterile applicator containing an alcohol-based chlorhexidine solution, following the manufacturer's recommendation for application and dry time. Allow the solution to completely dry. If there is a contraindication to chlorhexidine, use an iodophore, for example, povidone iodine, or 70% alcohol. Palpate and stabilize the selected artery with the index and middle fingers of the non-dominant hand proximal to the intended site of puncture. Change to sterile gloves if the puncture site must be palpated after it is aseptically prepared. Remove the needle cover and maintain the sterility of the needle. Inform the patient that he or she will feel a stick. While palpating the pulse, hold the barrel of the preheparinized ABG syringe like a pencil in the dominant hand with the bevel up and the syringe at a 30 to 45 degree angle for the radial artery or brachial artery. Enter at an angle that is comfortable to handle. Certainty of position is more important than the angle of entry. For a femoral artery puncture, hold the syringe at a slightly higher angle. Puncture the skin slowly while aiming the end of the needle toward the pulsing flow of blood in the artery. Advance the needle until a flash of blood appears in the hub of the syringe. If the puncture is unsuccessful, withdraw the needle to just below the skin level, angle it slightly toward the artery, and re-advance it. Do not withdraw the needle entirely from the patient. Draw the required amount of blood. Obtain only the volume of blood required for the necessary tests. Withdraw the needle. If a safety guard is available, snap it onto the needle by using one hand to gently press the device against a hard surface. Apply digital pressure firmly at or just above the puncture site with a gauze pad until hemostasis is achieved. Check the site for hematoma formation or bleeding. While maintaining pressure on the artery, express any air bubbles from the syringe without contaminating the environment with blood. When the safety guard is engaged, remove the needle and dispose of it in a sharps container. Seal the tip of the syringe immediately using a cap or blood air filter. Gently roll the syringe. When hemostasis is achieved, cover the puncture site with a sterile dressing. In the presence of the patient, label the specimen per the organization's practice. Complete the laboratory form per the organization's practice. If appropriate, Include the percentage of oxygen therapy, respiratory rate, and ventilator settings, peripheral oxygen saturation, SpO2, the patient's temperature, and the time the specimen was drawn. Place the labeled specimen in a biohazard bag. Then place the bag with the specimen into a second biohazard bag filled with ice slurry and transport it to the laboratory immediately per the organization's practice.